Hey everybody, I'm Leslyn Keith with the Lipedema Project. I'm president of the board and director of research, and I'm so happy to be here with you again today. I talk to you a couple times a month about research updates, stuff that's coming out, papers that are coming out, research that's coming out recently or in the last couple of years. There's been a lot. So I have not been able to get to all of the exciting papers and research that's been out. I've quite a backlog, but I have a fabulous paper to talk to you about today. So I want to talk to you right now about this paper that just came out in June of this year, 2023, the effect of a low carbohydrate, high fat diet on laboratory parameters in women with lipedema in comparison to overweight, obese women. This is a wonderful small study, gave us some really interesting results, some information. I think it's all adding to, everything that we're learning about lipedema really just in the last 5 years. So let me talk to you about this paper. It was done by a group of clinicians and researchers in Poland at the Wrocław Medical University. And participating in this paper and in the study is Dr. Zuba, who's done a lot of papers and studies about lipedema. And this same group did a previous study comparing a low carbohydrate ketogenic diet with a moderate carbohydrate ketogenic diet and the effects that it had on patients with lipedema. So this is now just another study kind of in that same vein, but looking specifically at those blood markers. So the aim of this study was to evaluate those alterations in blood work after 7 months on a ketogenic diet on patients with lipedema in comparison to overweight or obese women. And the blood work that they looked at liver enzymes, glucose, and the lipid profile. They looked at kidney function markers and markers of thyroid function. So just a really interesting study. So they had a total of 58 women with lipedema and 57 women with overweight or obesity that enrolled in the study. And a total of 48 participants completed the study. So that was 24 participants with lipedema and 24 in the overweight obese group. And so, of course, the intervention was 7 months on a low carbohydrate, high fat ketogenic diet. What did they measure? So besides the blood work, which I'll tell you about, they also looked at BMI, but they also looked at the waist to hip ratio, which we know is a better indication, a better marker for health for women with lipedema versus the BMI. They looked at circumferential measures. So they looked at the waist, the hip, the thigh, calf, and ankle measurements. So they really got that lower body measurements that they looked at for both groups. They looked at how adherence were they to the diet. So they checked that at 2.5 months, at 5 months, and then the conclusion of the study at 7 months. And that really dictated who was said to complete the study. That's one reason why they went down to 24 in each group, because they only wanted to check the blood work on people who are adherent to the diet. And so they did those checks. And so the blood labs, they did after 12 hours of fasting. They checked the blood at baseline, and then after 7 months on the low carb, high fat diet. And for liver function, they looked at, looks like 4 different markers of liver function. The lipid panel was total cholesterol, LDL, HDL, and triglycerides. The kidney function, 3 markers, creatinine, and GFR and uric acid. They did the TSH for thyroid. And metabolic health, they looked at the HbA1c, glucose, insulin level. They did a oral glucose tolerance test, and they calculated the HOMA-IR, which is a indication of insulin resistance. So let's look at the participants that were in this study. For both groups, the lipedema group and the obese overweight group, they were excluded if they had things like if they were pregnant, if they were breastfeeding, if they had lymphedema or edema from other things like chronic venous insufficiency, heart, kidney, liver failure. So that took them out. And also they did not want them to have liver, kidney, or heart failure, because that could confound the results on the blood markers. They also were not included if they had diabetes and thyroid disease, again, because that is going to confound the results on the blood markers. So all of these things, of course, are conditions that individuals with lipedema could have, but to really see the effect on just lipedema and not on all these other conditions that you might have along with your lipedema, we really had to exclude anyone who had those conditions. All the participants were female. They were divided then into either the lipedema group, and the lipedema group could be with or without obesity. And then they had another group that was obese or overweight females, but they did not have a diagnosis of lipedema. So that was our two groups, and 24 in each group completed the study. A couple things about the characteristics of the participants in the lipedema group. Majority were stage 2, and that was just over 54%. And the most common type of lipedema was type 3 at about 71% of the participants. And that means it goes waist to ankles is where you have the lipedema fat. And 33% of the participants had their arms affected. So that gives you a little bit of idea of what the lipedema group looked like. So at baseline, we're looking at all of the different measures that they did. And at baseline, it actually was very comparable in a lot of the baseline measures between the two groups. But there's a couple of notable differences that I want to tell you about right now. Age. So the lipedema group was actually younger. They were average age of 39, whereas the overweight obese group was 49. So a 10-year difference. In weight, the lipedema group actually weighed less than the obese overweight group. I didn't convert this into pounds, but if you're interested, if you know kilograms, it's 86 kilograms in the lipedema group and 90 kilograms in the obese overweight group. Waist measure. Now this is kind of what we would expect. The waist measure, lipedema had the smaller waist measure. It was 98 centimeters versus 106 centimeters in the obese overweight group. The waist to hip ratio, again, what we would expect is that the lipedema group had a better waist to hip measurement. So it was 0.85 in lipedema group and 0.93 in the overweight obese group. And just so you know a little bit about what is considered healthy, for women, anything below 1 is good. And but you can see that it was better for the lipedema group. Lower body measures, also what we would expect in the differences between the group. The lower body was larger on the lipedema group. Now, blood work. Again, baseline measures in the blood work were very similar. They reported in the paper that it was not significant difference. It was not statistically different, but a couple of things were. And interestingly, on LDL, the lipedema group had a lower LDL. So this is low density lipoproteins. This is considered supposedly the quote bad cholesterol. It may be an indicator of adverse events for your heart. Not been proven, that the evidence is not there yet, but the lipedema group had the lower LDL at 118 versus the obese overweight group was 146. And just to give you an idea of what is seen as good numbers for LDL, optimal is should be less than 100. So both groups were over that, but near optimal is 100 to 129. Lipedema group was in that, and borderline high is 130 to 159, and the overweight obese group was in that area. Again, we're not sure exactly what this means. It's being studied right now. What does LDL really mean for heart health and stuff like that? Triglycerides. This one, we are pretty sure that there's a lot of evidence that high triglycerides are evidence for a problem with heart health. And the lipedema group was lower triglycerides, a much more favorable triglyceride profile at 83 versus the overweight and obese group was 118. Not super elevated there, but still not as favorable as the lipedema group. And then all of the other important ones like HbA1c, glucose, insulin, and HOMA-IR that looks at insulin resistance, they were all slightly lower in the lipedema group, but not all of them were significantly or statistically different. But lipedema group was definitely more favorable in all those. And we looked at the criteria for metabolic syndrome, looking at metabolic health. You're said to have metabolic syndrome if you have abdominal obesity, high blood pressure, impaired fasting glucose, high triglycerides, and low HDL cholesterol. So if you look at those characteristics, when we looked at the people in the two groups, only 50% in the lipedema group had those symptoms of metabolic syndrome, whereas 68%, so 2/3 of the obese overweight group had the characteristics of metabolic syndrome. So we're looking at, by several markers, the lipedema group was actually much more metabolically healthy than the obese group. So then they did this 7 months of a very low carbohydrate or ketogenic diet. And when they assessed what the people in the group were actually eating, in the lipedema group, they had just under 3% of their calories were carbohydrate. About 71% of their calories were from fat and 21% from protein. And it was very similar in the overweight obese group. They were just over 1% of their calories in carbohydrate. So actually lower carbohydrate in that group, but not statistically different. Again, very similar in fat, about 71%, and similar in protein, 21, almost 22% protein for that group. So looking at the diet adherence and also the composition, the actual composition of the diet, both groups were very similar. So let's look at the results. Very interesting. So both groups lost a comparable amount of weight. And they also had very similar decreases in measures on the lower body. This is significant for an individual with lipedema because no other diet seems to reduce that lower body lipedema fat. And so by using this diet, the lipedema group lost as much in lower body circumference as the obese overweight group. That was important information. And then we look at blood panel numbers. Again, very similar between groups, but there were a couple of notable differences that I'd like to talk to you about. That the post-intervention, the LDL actually went up in the lipedema group and it went down in the comparison group. And so they started out with that LDL was much lower in the lipedema group. And then after the study, because one went up and one went down, they actually had a very similar LDL at the conclusion of the study. But LDL is, like I say, still a question of whether or not this is important for, heart health. So in the conclusions, it talks about how all of the other blood work that looks at metabolic health was completely favorable. And so even though LDL went up, they still felt like this was a safe, effective diet for participants with lipedema. So let's look at some of that other blood work. There was a statistically significant decrease in triglycerides in both groups. And actually the obese overweight group, they lost even more in their triglycerides. But remember that the lipedema group was already lower. And so even though the obese overweight group lost a higher percentage, they still did not have as low of triglycerides at the end as the lipedema group. So they both improved that way. But it was statistically significant that the obese or overweight group lost even more. And in HDL, remember that that's considered supposedly the good cholesterol. We want that one to be elevated. And so both groups had an elevation in their HDL cholesterol, but the lipedema group actually had a higher increase in their HDL. And liver parameters, glucose tolerance, decreased fasting insulin levels were observed in both groups, although they were less pronounced in the lipedema group. But again, they started out better in the lipedema group. So they improved even more, but I think the obese overweight group probably needed more of an improvement. So they had more of an improvement by the conclusion of the study. Thyroid and kidney were similar start and at finish for both groups. And the prevalence of that metabolic syndrome characteristics were similar before and after the dietary intervention. So they both had, there were fewer with metabolic syndrome in both groups. So conclusions. They conclude, I think rightly so, that although this is a small study and you can't generalize to every individual with lipedema, LCHF or low carb, high fat diets have the potential to not only improve the metabolic outcomes of lipedema and overweight obese patients, but they also seem to be really favorable on lipedema on the lower body. Let's see, the improvements in weight, BMI, triglycerides, HDL, liver parameters, glucose tolerance, decreased fasting insulin, all these things really suggest that this is a dietary approach that can have really a positive impact on both of these conditions, the overweight and obesity and lipedema. And there was lack of any adverse effects on either kidney or liver function. And this is continually brought up that this way of eating, this dietary approach, would be harmful on either kidney or liver. And this once again showed absolutely no adverse effect there. They said that they had a duration of 7 months. So this is not super long, but it's definitely longer than a lot of the studies that have been out there on lipedema and using this way of eating. I think the longest before this one was 16 weeks or 4 months. So this was 7 months. So this is very helpful. And it also had that comparison group of women with overweight and obesity. So that made it more robust in interpreting the results. So, but they still said, you know, hey, we were limited by a small sample size. There was 24 in each of the groups. It would have been helpful to have larger groups. And they would love to have an even longer study. They would love to do something for 12 months at least, and not just 7. So overall, I think there was a lot that we can learn from this paper. I have to say that I want to discuss it with Siobhan Huggins, our research specialist, not only from her understanding of research and how it's conducted, but also just the interpretation of various of those blood numbers. I wanted to see what conclusions that she can draw from the data in this study. That I think we can learn a lot from the study. I'm very pleased with this study. I'm looking over here at your comments right here. Thank you for posting things, everybody. Love it when I know that you're here. A Facebook user asked about Dr. Zuba. Let me tell you how he spells his name. It's S-Z-U-B-A from Poland. He's written a lot about lipedema. And so if you look up this, we give you the link for this paper. You should have it below. It's open access. You should be able to get the whole paper. And you can, Google him and see other things that he's written. Hello, Julia Marilee. Wonderful. Thank you for being here. Eileen, thank you for posting. And then one other thing before I have to go, I really want to tell you about this. Our big heart-to-heart event, virtual event, is coming up starting, tomorrow, October 27, 28, 29. It's not too late. You can sign up right now and join us. It's going to be a wonderful event. We're going to be talking about nutrition, but also a lot of other aspects about lipedema and lymphedema, quality of life and care, and living your best life. Please join us. We'd love to have you there. And that's all for me today. You know my email, leslyn@lipedemaproject.org. Please send me any of your comments or papers you'd like me to review. Love to hear from you. And I will see you again next time. Bye-bye.